Price, and I'm a physical therapist. Today, I'm going to share with you the Arthrokinematic Restoration System for the hip joint. And this is for someone that has arthritis in their hip, hip restriction, or pain in the hip joint. Before I begin, I'm going to speak a word of life from 2 Corinthians 10:3-4. For though we live in the world, we do not wage war as the world does. The weapons we fight with are not the weapons of the world. On the contrary, they have the divine power to demolish strongholds. Amen. So the goal of this channel is to provide physical therapy, intervention strategies, and nutrition tips to improve the quality of your life. So with the Arthrokinematic Restoration System is a method or set of principles. Restoration is just that, to restore, and arthrokinematics is joint movement, and joints have a very specific movement. There's two parts to it, a roll and a glide, and the philosophy that I go by is that if you fix the glide, you fix the pain, and you improve the mobility and restore the health in the joint. So the principle, the system, is you're going to release the muscle and the fascia that is opposed to the glide, and then you're going to strengthen the muscles that are in the direction of the glide. And so you've got to piece apart and know which way the joint is gliding. So I'm going to share with you how to generally restore the hip mobility and the inferior posterior glide. So if you have hip pain, hip restriction, have decreased space in your hip joint, this may be an approach to be helpful to restore that movement. So we're going to start with the release, then we're going to stretch, and then we're going to strengthen. So the question is, what are we going to release? There's two muscle groups that we will release. The first muscle group is going to be the hip flexor, which is going to go from the low back and attach into the inner groin, and then it's the inside of the pelvis attaching to the inner groin, the iliacus portion. So to do this, I like using the hip hook. Christine Koth, a physical therapist, designed and developed this, which is wonderful. This is the best thing that I have found to release the hip flexor. But if you do not have a hip hook, then I will use the lacrosse ball. So with the hip hook, the rule is in line with the nipple region. You're going to go in line with the hip, so coming right over, placing the hip hook right on that area and releasing the hip flexor there. So it's going to be inside. If you feel the bony portion on the front side of your hip and go inside that, that's the muscle group to release. So I will lie onto my stomach, place that hip hook on the muscle group, and gently apply pressure into that region. So I just want to hold until I feel a softening or a decreased tenderness and tension in that area. And this usually takes anywhere from 30 seconds to 2 minutes. I like to spend 2 minutes. If it's really painful, then you want to ease into the toleration and get the muscle to relax and not be overly aggressive when you begin this. So I want to release my hip flexor, and I can move around till I find different portions that are tight or tender and release that there. And as I said, if I don't have a hip hook, what I'll use is a lacrosse ball. I'm going to place that in that same region on the inside of the hip, and I'm going to place my body weight down onto that lacrosse ball, and then you can even pump the leg up and down. The lacrosse ball is not as effective, but to get added pressure to release the muscle and the fascial tension, I'm going to lift my leg and mobilize that region. And lying, I can then also turn my leg out so that I can get to the inside of that hip better. And I just want to spend about 2 minutes working on the hip flexor. So release the hip flexor first. Then I'm going to release my glute minimus and my gluteus medius. And that's going to be on the outer portion of the hip. So if I am standing, or place your hand on the outside, you're going to feel a bone sticking out. That's your greater trochanter. So that's where you've got a lot of the rotators attached to. And you're then going to find the top of your hip, the iliac crest, so that's the top of the hip, and you've got your trochanter. So that region in between is what you're going to release. Just above that trochanter is the gluteus minimus, and above that is medius. Now this can be really painful if it's not been addressed. You want to take that lacrosse ball, place it just in that region, and you're going to lie directly on your side. It makes a difference, and if it's too tender, you'll find you'll want to come up onto your elbow, but you'll place it there, go onto your side. The back leg is going to be behind your body, and then you're going to keep the leg that you are placing pressure on that side. That leg stays straight. And then I'm going to take my hips and I'm going to rock forward and then rock backwards. So I'm just mobilizing perpendicular to that muscle. And this can be really tender, but you want to address the side there on the glute minimus medius. And there's always a progression to these exercises. So once that you have been able to achieve more comfort in this position, you can then actively release, bringing that leg up and then straightening it back out and just working on mobilize the fascia and muscle there. 2 minutes there. So I'm going to spend 2 minutes on my hip flexor, my iliacus, and then I'm going to spend 2 minutes on the gluteus minimus and medius muscle on the outside. After I have done the releases, I'm then going to stretch those muscles. And I will do this with a moving stretch for this particular one. To do a moving stretch, I'm going to stretch that same side that I just did. So I'll place my opposite leg forward, and then I'm going to mobilize, move so that my knee is turned out. I'm going to switch directions so you can see this, and then rock to the other side. I'm going to do this slowly and do it for 1 minute. And I can do up to 3 of these going the other direction. So I'm going to go into that lunge position, hands are down, and then I'm going to turn my hips so that I can feel a stretch on the inside. And then I'm going to roll gently towards the outside, dropping the hip down and spending 1 minute in that moving stretch. So that is going to be the releases and the stretch for the hip. After I've completed the stretch, I want to strengthen in the direction of the glide. So I want my inferior and posterior glide. So what I'll do, and you want some good resistance that's going to be challenging for you, so I'm going to take my loop band and just double that. I'm going to go above my knee. And then to get the, to strengthen in the direction of the posterior glide, I'm going to just do a clamshell. So I'm going to activate my rotators in my hip. You don't want to rock your hips back when you do this. And you just want to rotate that knee up towards the ceiling, bringing it right back down. And you want to do this 3 sets of 12 is what I like. You can do more for endurance, but you want it to be challenging. So I will start with doing 3 sets of 12, activating the rotator. You should feel this working in the buttocks. And bringing back down. I'm going to complete this 1 set, and then you would do 2 more sets here. And you can start with just 1 if it feels weak. And if you're having pain, you want to skip the strengthening portion so you can do the strengthening without pain. I'm going to do 4 more. 4, 3, 2, and 1. So now I want to do strengthen in the direction of the inferior glide. So the direction I'm going to co-contract, I'm going to do an isometric hip adduction with a closed chain abduction. So to do this, this is going to be the most challenging position. I'm going to show you another one to start with if the side plank is too progressed at this time for you. But you want to take a firm, and I like the soccer balls because it's got some firmness, but it's also got a little bit of give. And I want to squeeze my legs together. So I'm really going to give pressure there. That's going to activate my adductor muscles. Then I'm gonna drop my hip to the floor and I'm gonna push back up, drop down, and pressing back up. I can hold for a count of 10 and drop down, pushing back up. And I can do 3 sets of 12. And you do not necessarily have to hold for the count of 10 to do the 3 sets of 12. So you can continue to drop and lift up and drop and lift up. The whole idea is to activate the adductors with a closed chain abduction. So another way to do that is standing. And what I'll do is squeeze, tighten your thighs, squeeze your legs in. I'm going to push down through that leg, lifting the opposite, but I'm lifting the opposite by using the muscle on the standing leg. And what I'm doing is basically sliding that soccer ball up, hold, and dropping it right back down. So I can do 3 sets of 12 here, or I'll do 10-second holds and do 6 repetitions of a 10-second hold. So either one, you're activating the muscle. So that is the release, stretch, and strengthen to restore the arthrokinematics of the hip. And what you're looking for is more mobility when you bring your knee up towards your chest. So as the leg comes up, you have a superior anterior roll and a posterior inferior glide. So we want to get that posterior inferior glide back, and that is going to be the series to do that. After you've completed that, if you have hip restriction or hip pain, I have done some videos on the Agascu method for chronic hip pain or hip restriction. And once you have restored the joint movement, you can then work on the postural exercises to help the alignment in order to maintain the gains that you are making with the exercises. So I hope this is of help, and have a blessed day. Thank you.